Thanks very much. So over the next couple minutes, I'll kind of walk you through some of my PhD work that I recently finished up last November. So just to give you kind of an oversight or overview of what the veal industry is like in Canada. So we have about 1 million dairy cows in Canada, and the use of conventional semen is still quite common. So the typical dairy farm will produce a significant number of male calves, so resulting in about 500,000 male calves being produced every year. And depending upon where they're located in Canada, they'll either go into the dairy beef industry if they're located in the western portion of Canada, or they'll go into the veal industry if they're located into Ontario and Quebec. Currently, there's a significant number of challenges in raising these male calves. Here's a list of a few. Mortality. If you look at published peer-reviewed papers, it ranges anywhere from 5 to 8%. But if you talk to some of the industry experts in Canada, they suspect it can go up to about 15 to 20%, especially in some outbreak situations. If you look at morbidity, a significant number of calves get sick during their growing period, with pneumonia and diarrhea really being the most common causes of that. And clearly with these high levels of health challenges will also lead to high levels of antimicrobial use. I was just at a presentation by Theo Lamb this morning, and he showed the resistance patterns in some of the veal calves, and they're substantially high, likely relationship to the high levels of antimicrobial use. So with all these challenges, we really have to kind of address this so that we can create an economically sustainable industry for these producers. So the real question is, where do you start? So we have all these challenges, and with challenges lead to opportunities. And I think this is the biggest opportunity for producers to really work through some of the challenges that they're faced. So just to orient you, so we got mortality count on your y-axis, and on your x-axis you have the weeks in the barn. And what I'm trying to highlight in these bars that are in blue is really that the peak amount of mortality really occurs in the first 3 weeks after they arrive to the facility. And the same can be said for both morbidity and antimicrobial use. So this is why we kind of picked the first 3 weeks as being really the target or area that we can potentially have the greatest impact. The two objectives of the study were really to describe the health status of these calves as they arrive to a veal facility. And the second was to determine if any of these health parameters are associated with mortality risk occurring at any point during the production period. To do this project, what we did was we screened calves immediately as they arrived to the veal facility, and we did so using a standardized health scoring system. So we used the Calf Health Score app, which was an app developed by Sheila McGurk at the University of Madison, Wisconsin. We used a scoring system from Baylor et al. In Switzerland, and then we also used a scoring system from Wilson et al. In the United States. We then use a prospective cohort study design where we screen the calves at arrival and we followed them until they died or until they went to slaughter. And then we use a Cox proportional hazard model to explore which health parameters are really associated with the risk of mortality. And for this particular presentation, we just focused on the less than 21 days after arrival, or that early mortality period that I highlighted at the beginning of the presentation. So in total, we screened 5,000 calves as they arrived to the facility, and we did this between November of 2015 to September of 2016. And 136 of these 5,000 calves died, representing 2.8% mortality risk in the first 21-day period. So over the next couple slides, we'll kind of try and highlight, what was associated with early mortality. So this is a calf that died in the first 21 days, and over the next couple slides, we'll kind of fill this in. The first thing that was associated with early mortality was the presence of an abnormal navel score. So what we did to evaluate navel score was we went and we palpated each individual navel or umbilicus, and we looked for size, we looked for heat, we looked for pain, and we looked for moisture as well as malodorous discharge. And we put that on a scale of 0 to 3, okay, ranging from normal to severely affected. Just to orient you on this slide, because the remainder of the presentation will be very similar. So on the top part, I have the prevalence of the health scores, and on the bottom, I have the output from my hazard analysis at the bottom. And what you'll see here is that about 25% of calves had what was defined as a normal navel, or a navel that was around 8 millimeters in diameter as measured by a caliper. About 50% of calves had a navel score of 1, which was also deemed to be normal, okay, where it was slightly enlarged, but there's no heat, pain, or moisture that was present. 20% of calves had a navel score of 2, which we deemed to be abnormal. So it had an enlarged navel with heat, pain, moisture that was present. And finally, in 6% of calves, they had a navel score of 3, which was defined as really navel infection, which was significantly enlarged with heat, pain, moisture, or malodorous discharge. And if you move your attention to the bottom of the screen, you'll see that if they had a navel score of 3 and compared back to a navel score of 0 and 1, they had a greater hazard of dying in that first 21-day period. So there's many reasons as to why that is. Obviously, the navel is a really vascular tissue, especially after birth, making it really susceptible to having bacterial inflow into the body. So you can get some local inflammation at this level. You can get some level of peritonitis, potentially going up and causing abscesses in the liver, maybe back to the bladder, and also leading to septicemia. So that's the reason that we likely saw that association. The next thing that was associated with early mortality was the level of dehydration at arrival. How we evaluated dehydration was we looked at skin tint, we looked at attitude, and we also looked at suckle reflex. And again, we scored that on a scale of 0 to 3, with 0 being mild and 3 being very severe. A really interesting finding of this study was that about 46% of calves arrived to the facility with some level of clinical dehydration, so some level of noticeable dehydration, where we had mild representing the biggest portion of that group, so 5 to 7% dehydrated, moderate 7 to 9% dehydrated, and then finally severe being greater than 10% dehydrated. And what was interesting when you look at that in the Cox proportional hazard model is that every level greater than 0 was associated with a greater risk of mortality occurring that first 21-day period. So why are we seeing such high levels of dehydration? I think it's a reflection of how we transport these calves in Canada. So quite a few of them go on some fairly long journeys before they arrive to the facility. So ranging from up to maybe 8 hours to up to 10 to 12 hours. And they're not provided with any fluids during this transport. The association with mortality is really not tremendously clear, other than potentially as an impact on immune function. One of the next projects that we're going to conduct is really looking at these dehydrated calves to see what makes them a greater risk for mortality. The next one that was associated with mortality was source of the calves. There's 4 main sources of the calves that came into the facility. We had locally derived calves, which are calves that came from local dairy farms and were dropped off directly, representing about 20% of the calves. We had drover-derived calves, which was a person that went to multiple dairy farms and picked up the calves and then dropped them off at the facility. We had auction-derived calves, and we also had a few from the United States. If you look at the bottom in our Cox proportional hazard model, you'll notice that if they're drover-derived calves, they actually had a lower hazard of mortality occurring in that first 21-day period than if they're locally derived calves. And again, this was kind of a surprising finding because you think that if they came locally from the dairy farm directly to the veal facility, they might actually have a lower hazard of mortality. So some of the reasons that this could be is that the locally derived calves really came in and there's no screening that was done by the facility staff. So they just paid for all the calves that came in on each Tuesday, and they didn't provide any monetary disincentive to bring in sick calves for these local producers. Whereas for drover-derived calves, the drovers were really penalized monetarily for bringing in sick calves. So it's likely that they implemented themselves some type of screening process before they brought the calves into the facility, and that's the likely reason for that association. The next one was body weight at arrival. So we weighed each calf coming into the facility, and the average body weight of these calves was about 46 kilos. So very different from the European market where they're come in at a significantly older age. We found an interesting relationship with this where it was very linear, where the hazard of mortality was a lot higher in lighter calves coming to the facility and a lot lower in calves that were heavier when they arrived to the facility. This isn't really a new finding. If you look at a lot of the other research evaluating veal calves, you'll find the same association where heavier calves actually have lower risk of morbidity as well as mortality. And likely this is a reflection of age, potentially nutrition as well, that would have an impact on this finding. The next one was a cough score. And what we did to evaluate cough score was we palpated the trachea of each calf to try and see if we could elicit a cough. And as you'll see here is that many of the calves didn't come in with an abnormal cough score. Some calves, about 3% of the calves came in where you can induce a single cough, and then about 1% of the calves came in where you could induce more than one cough when you stimulate their trachea. And if you notice on the bottom, if they had an abnormal cough score of 2, they had a 3 times greater hazard of mortality occurring that first 21-day period. And that's likely a reflection of these calves potentially already being affected with pneumonia. The next thing that we evaluated was the sunken flank of these calves. How we evaluated sunken flank was basically we looked at behind the rib cage, below the transverse processes, and we looked at the paralumbar fossa. And it was a really crude measure where it was scored on a scale of yes or no. Where yes, they basically had depression in this paralumbar fossa, and no, they had more fill in their abdomen. So about 25% of calves came in with a sunken flank, and if they came in with a sunken flank, they had a 1.5 times greater hazard of mortality occurring that first 21-day period. And I think this is probably a reflection of the nutrition received on the farm, potentially prior to transport before they arrived to this facility. Okay, so what does all this mean? What is really important when you're looking at the association with early mortality? So to really answer that question, we did a Monte Carlo simulation model, where basically we did a simulation of, we did 10,000 iterations to really see what came out as being the most important. So really the most important parameter when you're looking at the association with early mortality was the weighted arrival. So calves that came in really light, as highlighted in the input low here, were at a greater risk for dying that first 21-day period compared to heavier calves that came in. And that was the biggest factor that we saw associated with that. The next one was a dehydration score, where calves that came in with a high level of dehydration or severe dehydration had a greater risk of mortality compared to those that did not. Then it was the source of the calves, the navel score, sunken flank, and finally the cough score. So ultimately, what did we learn through this study? I think we learned that a lot of calves enter into this veal industry in Canada with a significant amount of health abnormalities. So about 26% of calves came in with an abnormal navel score. 46% came in with some level of dehydration. And there's quite a few calves that entered in with low body weight. The nice thing from the study is that we really were able to identify some of these high-risk calves and found that there is an impact on mortality that was found with this. So potentially the next step is to do an intervention study on these calves, looking at the ones that are high risk and see if we can treat them to reduce the risk of mortality. So with that, I'd like to acknowledge some of the sponsors of my research, the Grober Group, Ontario Ministry of Agriculture and Rural Affairs, Dairy Farmers of Ontario and Veal Farmers of Ontario, and I'd like to thank the research assistants that helped me conduct this research. And thanks, and I'll take any questions.